Aibovan, and a very good evening to all our viewers here on TV1. I am Dr. Dilshan Fernando and this is your weekly dose of wellness here on Healthline. Today we thought of talking about a condition which is very common. I am sure most of our viewers have at least one family member who has this condition. It is so common that we should definitely talk about this condition in depth, and we have invited a consultant physician, Dr.Shehan Silva, to the studios to talk about this condition in depth. So, very good evening to you, sir, and thank you very much for gracing the Healthline studios once again to talk about this very important topic.
Good evening, viewers. It's a pleasure to be back on Healthline, and today we will be talking about hypercholesterolemia.
As I said, very common condition, but what is it actually?
First and foremost, I think it is prudent that we understand what cholesterol is. So, cholesterol has been in the bad books for the last century or so. But what is cholesterol? Cholesterol is a chemical that is found in the body which helps as a building block to make certain chemicals, for instance things like steroids, which are essential to maintain the bodily functions, to maintain growth, to maintain blood pressure, to maintain other physiological things, even things like birth of a child in the form of prostaglandins. So, it is essential to know that cholesterol is a substance that is essential in our body, but unfortunately what happens is when it goes beyond a state excess, there is a state called hypercholesterolemia, and this is followed by certain medical problems. So, then we panic. So, before we panic, we need to know whether somebody has a risk or whether somebody has a high level of cholesterol, or what we call as hypercholesterolemia, or the other term is dyslipidemia.
So, now I said it is very common, sir, and we know in our day to day practice we come across so many patients, but when we talk about numbers, how common is it really?
So, there have been several studies that have been done in Sri Lanka, and if I may put it plainly, it is estimated that 1 out of 4 Sri Lankans have high cholesterol levels. If you take the difference between men and women, you see that 1 out of 3 women, adults that is, would have high levels of cholesterol, and 1 out of 5 males would have high cholesterol levels. So, you see that when both of those fractions and the statistics come into play, that 1 out of 4 or 25% of our population, or it may be more, whether you are living in an urban area or a suburban population rather than in the rural setting, you see that it is more common, more prevalent.
So, 1 in 4 Sri Lankans are supposed to have hypercholesterolemia or high cholesterol, which is about 25% of our adults. So, which is quite an alarming number, and I am sure, like Dr. Shehan said, the number may be more depending on your setting and with the lifestyle that we are leading these days. Now, sir, earlier high cholesterol was associated with old age as we got older, but I think the trend seems to be changing now. So, what is your opinion on that?
So, as our lifestyles have changed, we are less mobile, we are more sedentary, we have a bad lifestyle, like eating junk food. Even though it is not junk food, let us say we eat a lot of starch, we eat a lot of fatty food, we are confined to an office or a setting where we hardly move, we do not have exercise, maybe we do smoke, various lifestyle changes. All of those come into play and puts a person at the risk of developing high levels of cholesterol. Leaving aside high levels of cholesterol, all of these factors, which we will talk more, they also give rise to other medical problems that are associated with high cholesterol. So, you see that although the stork comes and puts one egg in the nest with high cholesterol levels, you see that the stock would put other medical problems also into the nest, and these being high blood pressure, diabetes, and risk of other non-communicable diseases. Non-communicable as in it will not get transmitted from one person to another person through the breath or through touch or through bodily substances, but it is through our own faults that these conditions do manifest in our life.
Definitely, even though it's a very common condition, it's something that can give rise to so many undesired complications. So, it's always good to keep an eye out on your cholesterol levels, and if it is high, always seek the treatment of a properly qualified medical practitioner and get proper treatment for that and proper follow up done. Now, as we spoke about the lifestyles and all that, a bit of overlap from my next question also, sir, about the risk factors. Now, apart from the lifestyle and the diet, are there any other risk factors that is associated with this high cholesterol levels?
Yes, very interestingly, just like the other medical problems that I mentioned of high blood pressure, diabetes, obesity, you can categorize the risk factors into two. They are those that are modifiable and non-modifiable. If we take the non-modifiable ones, these are things that we cannot change. The fact being, we being a man compared to a person who is a female, a male person has a higher risk of developing cholesterol and associated disease. The fact that, as you mentioned, as we age, there is a tendency for cholesterol to manifest at a later stage in life. Having said that, we have a trend that even youngsters have high levels of cholesterol these days. Childhood obesity has been a problem. It is actually a silent disease in our community, and we see that more and more adults, young adults, manifest with high cholesterol levels. And of course, the sins of our fathers, our genes. So, that also takes a place. If you had a parent, if you had if your mother or your father had cholesterol, you are at a higher risk of developing high cholesterol levels. Even so, there are genetic disorders where families have high levels of cholesterol going on, and these are diagnosed by various criteria by doctors. It's not so very commonly identified in our society, these particular syndromes, but you see that there is a genetic predisposition. So, the age, whether you are a man or a woman, and whether your genes contribute. So, all of those are non-modifiable risk factors. Of course, there are modifiable risk factors. These are things where you can take the seat, you being the captain of your soul, you are able to change. What are these? First and foremost, the diet that you take. We will talk about these things in deeper levels later on, the food that you eat. The exercise or being sedentary. So, if you do more exercise, if you become more mobile and you active, your cholesterol levels and the risk of developing high cholesterol levels and the associated diseases would come down. Definitely smoking. If somebody is a smoker, there is a higher level of developing cholesterol and associated diseases. The other thing, very difficult to control, but I suppose there somebody would be able to do some change in the lifestyle is the stress, whether it is a physical stress or psychological stress. If somebody is going through a rough patch of time, those people would definitely manifest with high cholesterol levels, maybe without any symptoms or with symptoms. But those are the sort of the risk factors that we have to know about. So, the modifiable things where we can make a change.
Definitely, as Dr. Shehan very correctly says, there are certain things that you can't modify, but there are certain risk factors that are modifiable, and like sir says, be the captain of your own ship and control these things. And because like we earlier discussed, high cholesterol doesn't come in isolation, it comes with a whole cluster of diseases which can give rise to very bad effects as we go on. So now, sir, which brings me to the question: how do you actually diagnose high cholesterol? We know that certain people go and do these blood tests, but if we can just elaborate on what this test is and how do you actually diagnose?
So, before diagnosis, I would like to mention about the signs and symptoms of this disease. So, unfortunately, just like diabetes or high blood pressure, cholesterol comes without any warning, like a thief in the night. So, a perfectly normal person, you may think that you do not have any illness, you are perfectly healthy, but you may be having cholesterol, high levels of cholesterol swimming in your blood. Having said that, then what would happen is certain people would get various symptoms, and these symptoms are very vague symptoms. For instance, people would say that they are tired, they are lazy, they feel they have malaise, they will not be able to cope up with the amount of work that they do, and they will fall asleep quickly, and they have a tendency to have somnolence. Certain people have other signs and symptoms as well, like headaches, generalized headaches which are difficult to explain. Maybe sometimes doctors may label them as having migraine or tension headache or cluster headache. Sometimes people may have soreness of muscles, body aches here and there, everywhere. So, these are the things that one should be cautious of, to think about whether somebody is having high cholesterol levels. But if cholesterol is not controlled, of course, it can manifest with certain diseases, things like heart attacks, as we say, as ischemic heart disease or myocardial infarctions, where heart muscle is damaged, or in the brain, a stroke or any kind of a bleed in the brain. Those are the two main organs that are affected by high cholesterol levels. Of course, the other systems also get affected. For instance, the kidney blood supply to the kidneys, to the legs, the muscles of the legs, all of them can be affected. But you see that it is a spectrum of disease. So, it can start without any warning, or it can just crumple down like an avalanche without any warning, but the effects are devastating.
So, which brings me to the question: so how do you actually diagnose this? What should
so the test that we do is a thing called the lipid profile. It's a simple test where one is advised to fast for at least 12 hours, not more than 14 hours, not more than 12 hours, but just around 12 hours. I have to stress on the fact that fasting means fasting for food as well as beverages, including tea, coffee or fruit juices, with or without sugar. But if one is feeling thirsty, for the normal thirst, that person could take a sip or two of water overnight. So, that can be done. So, coming back, the test is called a lipid profile, where after this fasting period, the phlebotomist or the person who takes the blood from the patient transports it in a vial of glass vial, and then several hours later you get a report, and you see, unlike the fasting blood sugar report, it is a complicated report. You have
various
so many
components.
Yes. So, so then that is the place where one should look out what is wrong with my cholesterol. So, if you would see that various labs have various cutoffs that are given for cholesterol. Usually what is taken as is the total cholesterol as well as the other breakdown products. But if the total cholesterol is more than 200 milligrams per deciliter, that is definitely an indication that that person is having high cholesterol level. Before we move on to the other diagnostic parameters in cholesterol, we need to know what the components of this lipid profile are. So, you see that there are at least about 4 important areas. So, the first and foremost is what you call as the LDL or the low density lipoproteins. So, the low density lipoproteins is the vehicle that of cholesterol from the liver and to the places where the cholesterol is made, like the liver or the intestines, where it is transported to the distant areas like the fat cells, the muscles, the brain, etc. So, you see that LDL contains quite a high amount of cholesterol that is in transmission. So, if somebody has high levels of LDL, that means it has not been taken up by the body. Therefore, LDL is also called the bad cholesterol. So, the low density lipoproteins are called the bad cholesterol. In contrast to this, you have the HDL cholesterol, or we call it as high density lipoproteins. So, this is the good cholesterol. So, what do you mean by good cholesterol? This is the vehicle which takes back the free floating cholesterol from the blood, which is there at the places like the fat cells, the brain, the muscles, etc., where it collects this free floating cholesterol, puts it into the vehicle and takes it back to the liver, so that there is no bad cholesterol circulating in the blood. So, you see that higher the range, higher the amount of LDL that is there in blood, you are not doing good. If you have higher the levels of HDL, you are doing excellent, you are doing good. So, those are the 2 main areas. The third one, of course, is called the triglycerides, which is absorbed from your diet or which is made in the liver. So, it is a different type of a cholesterol, and you see that the triglycerides are the ones that take this simple type of cholesterol into the cells. So, again the triglyceride levels are at a higher risk of, higher the level of triglyceride, the person is at a higher risk of developing high cholesterol related problems, which we will talk about. So, these are the 3 areas in this lipid profile that we are cautious about. So, if you come back to the lipid profile and if you look at it, and if you have a cholesterol level of about total cholesterol level of 200 or more, a LDL value of more than 100 milligrams per deciliter, or a triglyceride level more than 150 milligrams per deciliter, that is where we are concerned whether somebody is at risk of developing problems with high cholesterol levels. So, what do you do? So, it is not your task to determine whether you have high cholesterol levels or whether you should take this drug or that drug, or whether you should wait. You need to see your family doctor, or you need to meet a general physician and internal medicine specialist, and the doctor or the consultant would look at you, not just looking at your report. So, what an experienced doctor would do is, the experienced doctor would look at you as a whole and will risk stratify you. So, there are various things that stratifies your risk of developing cholesterol or these non-communicable disease related medical problems. So, what are those factors, which I think we discussed them, but I would reiterate: your age, whether you are a man or a woman, whether you have diabetes or not, whether you are a smoker or not, plus your cholesterol levels. So, all these factors come into play, and there are various charts, various calculators that people use, and that will tell, okay, what is your risk of developing a heart attack or a stroke in 5 years or 10 years or whatever. So, depending on the risk, whether you are falling into a red zone or amber zone or a green zone, the doctor will determine, okay, you need to take a statin. You know, we will wait a couple of months, I will give you advice on what you should do. So, that is how the decision is made. So, it is just not simply the number that you see in the lipid profile report. Do not be misled, please consult a doctor.
Definitely, because we tend to see patients when they get these lipid profiles, they tend to look at the numbers, they refer to the reference range and say, okay, I am doing good, I am doing okay, I do not think I need treatment. So, that is a very, very bad tendency that we see in our society, even amongst the people who are very knowledgeable on other aspects, not in medicine of course. But now, before we move on to treatment considerations, I would want to ask this question from you. Now, we discussed about these risk factors that a person may have, and that the fact that the younger generation seems to be developing this condition much earlier on than the previous generations. So, about screening, if a person has these risk factors, when should they start screening and how often should they do it?
Okay, that is a very good question. If you are concerned about when you should get yourself screened, I would say first and foremost you have to see whether you have a risk of developing any of these conditions or the diseases that we spoke of. So, the older you are, definitely, let us say you are 30 or 40 years, that is where you should come. But let us say you have had childhood obesity, you are a sedentary person, you are just fidgeting around with your video games and you are not doing any having active lifestyle, then that age would come down. It is an arbitrary figure, it is not that you cannot tell, okay, this is the age that you should come. Definitely, if you have had a family history of high cholesterol levels, if you had a family member, a first degree relative like your parent or your siblings having had a heart attack or a stroke at a young age. What do you mean by a young age? Somebody getting any of that less than 55 years of age or less, or if it is a woman even lesser than that. So, that is the time then you have to worry about, you have to be cautious about doing a lipid profile. So, there is no particular age, but then again you need to also remember that there are secondary causes of high cholesterol manifesting as well. The most important disease that you have to think about is if you are having a disease called hypothyroidism, where your thyroxine levels are low and you are on thyroxine, you should get yourself screened at an early stage. Maybe so that your thyroxine levels are not adequate in your body, and that may be the manifestation of the cholesterol levels coming in because of your low thyroxine. And once you have an optimum level of thyroxine in the body, you see that the cholesterol may just fade away in your body. Certain other chronic diseases also makes a person at a high risk of developing high cholesterol. For instance, things like rheumatoid arthritis, or we call them inflammatory arthritis, things like lupus, autoimmune conditions where the body fights its own cells. So, those people are at high risk of developing this cholesterol related disease. So, what I am actually meaning in this scenario is that there is a disease process that is called atherosclerosis that goes on in a person who has high cholesterol levels. So, what is atherosclerosis? Atherosclerosis is when the free floating cholesterol depositing them in the interior of the blood vessels. If you look at this image, you see that you know that the blood vessel is a cylinder or a tube like thing, and in the interior where the blood flows like water, on the inner wall, when the cholesterol gets deposited, you see that there is a gradual development of a thing called a fatty plaque, and as one advances in age, as one has increased levels of cholesterol, as one has increased risk factors like stress, smoking, heavy consumption of alcohol, you see that this fatty plaque gets laid more and more, and the interior of the blood vessel gets occluded. And what would happen? The blood that is flowing, that blood that needs to go to the end of that artery, to the periphery of that artery, gets hampered, and they develop ischemia or reduced blood supply. So, that is the manifestation of things like angina, where I say that there is heart pain, chest pain, and also when this atherosclerotic plaque ruptures, you see that there is a clot formation, and that is the end of it. You see that there is complete blockage, and there will not be further blood flow to the ends. That is where the heart attack comes in, that is where the stroke comes in. So, that is very important to understand.
Definitely, having high cholesterol levels can lead to these bad outcomes like heart attacks and strokes, which leads me to the question, sir, since you mentioned atherosclerosis, does it always mean that only if you have high cholesterol levels that these plaques can occur, or can it occur in patients without high cholesterol levels or undetected high cholesterol as well?
So, that is very good question. You see that sometimes people who do not have diabetes, people who do not have hypertension, blood pressure, do not have a genetic history, they may have these things like heart attacks and strokes going on. So, these diseases such as heart attacks and strokes are not they are not conditions where you can tell by an equation. So, there are many factors that come into play. So, and these factors, the way that it affects one person may be different to another person. So, just because somebody does not have high cholesterol, you can't just rest on your laurels and say, okay, I will not have a risk of developing heart attacks or strokes. All we need to do is we have to change our lifestyle, we have to take care of the chemistry in the blood, we have to take care of what we are eating, take care of how we use our calories, and how we take care of our body in forms of smoking, alcohol, etc.
Definitely, that is the reason why we bring these sort of programs to you, so that we always advocate a healthy lifestyle, which will inadvertently mean that we are always at a lesser risk of developing all these diseases, like these non-communicable diseases especially. So, now moving on to the treatment considerations of high cholesterol, sir. We know that as you mentioned, in certain cases it's a very individualistic approach. So, if you talk about non-pharmacological or lifestyle changes that you may advocate to a person, if you can elaborate, because most of our viewers are a bit confused sometimes, what should I eat, what should I avoid, how much should I exercise, how much should I stay active. So, if you can just give advice on that.
So, if you are talking about lifestyle changes, it is essential that you address diet, exercise, smoking and alcohol. If you are talking about diet, it is essential that you reduce the amount of starch as well as your lipids. Why I elaborate on the starch is, you think okay, starch always equals to diabetes, lipids equal to cholesterol. It is not so. When these chemicals, when this food gets digested in the intestines and they get into smaller particles, the building blocks, any of these building blocks can change its form in the liver or the intestines. So, the sugar can become cholesterol, the cholesterol can become sugar. So, it is essential that the amount of carbohydrates, the starches that you take are reduced. So, what we advocate is reduce the amount of starches that you take, and if you are taking starches, you need to take starch which has more fiber in it, so that the absorption of the sugar gets impeded. So, it is reduced. So, just if you take on one side rice or just plain white rice, or if you take bread, half a loaf of bread or even 2 slices of bread, or things like pasta or noodles or whatever, and if you compare it with something like red rice which has more fiber in it, if you are talking about having more of fiber containing things like other cereals, the things like gram, the legumes, the gram, green gram, the cowpea and various other cereals, and also certain things like vegetables where they have a lot of fiber in it. So, if you compare these two, you would see that the plate that has more of these complex carbohydrates would be healthy for you. And you need to be careful about the amount of starch that you take. Just because you are taking one slice of bread and maybe you are eating more of red rice, let us say like a mountain full of rice or a big plate of rice, that does not give you that does not make you at a less risk of developing any of these diseases. So, it is the quantity also, the quality as well as the quantity matters. If you go beyond that, you need to also be careful about the amount of fat that you take, especially with regards to the oil. Deep fried stuff should be avoided. Much as possible, have them grilled or braised or without having oil at all. That would be the best thing. If you are talking about the meat, you have to be careful of red meat, especially things like pork and beef with fatty elements in it. Some people like to eat things like organ based meat, like we call it offal, like heart, brain, kidneys, etc. So, those and even intestines of certain animals. So, those have high levels of cholesterol in it. So, you need to eat lean meat. Lean meat is the meat that does not have any fat, and try to avoid red meat as much as possible. Eat fish, and also you need to cut down on things like dairy products, like full cream dairy products, cheese, butter, etc., and go towards a simpler dietary mechanism. From diet, you move on to exercise. If you are talking about exercise, you need to be active at least with moderate level of activities, for instance like brisk walking or running or even swimming. If you can do some kind of exercise of like that sort, half an hour a day for at least about 4 to 5 days, that will be great. If you can't engage in some sort of an exercise, you could even do things like walking up the staircase, or even carrying your groceries without going in a vehicle. If you have the closest supermarket, if you can walk to the supermarket and bring your groceries, that is an exercise. Small things. Even if you could do a little bit of weightlifting, you do not have to go to the gym and do weightlifting like that. If you can lift a water can, like a 15 or 10 or a crate of water bottles, if you can do a simple thing, that will take a long way. So, that is exercise. These things we have been I think reiterating in other diseases like diabetes and high blood pressure as well, but we need to mention about that. Smoking, a definite no. If you are a smoker, you need to completely stop smoking. If you have you are contemplating on stopping, and if you are really wishing to stop smoking, please go and meet a doctor. The doctor would help you with that. Smoking is a no. Alcohol, lot of people would say, okay, taking alcohol is beneficial for the heart.
Yes.
Various things, but those studies are not generalizable. The research that has been done is not generalizable to all the populations in the world. They may have been done in certain countries like Japan or in the States or UK or whether it can be applicable to our setting is a different question. Even so, you see that high levels of alcohol intake would definitely shoot up the cholesterol, especially the cholesterol type that I mentioned, which is called triglycerides, which comes from the diet, that will shoot up the cholesterol. So, if you are taking alcohol in moderation, or if you can completely stop alcohol, that would be the best thing, but you have to be mindful about the amount of alcohol that is. So, that those are the key non-pharmacological messages that I would have to tell you with regards to curbing high cholesterol levels.
Definitely. So, those are things that we can always take control of, modify and make sure that our disease process does not get expedited, if I may put it that way. A good diet, a good active lifestyle, cutting down on alcohol and not smoking at all. So, which leads me to a question, sir, about this good fat that they talk about, avocados and all that. So, if you can just elaborate on that, I think that would be beneficial.
So, yes, very interestingly. So, you have two types of fat, which is called cis and cis fatty acids and trans fatty acids. So, all depending, it's the chemical appearance of the fat molecule, how certain areas of the molecule are placed. So, leaving aside that, the cis molecules or cis fatty acids are better than the trans fatty acids. So, how do you get trans fatty acids? That is the important question. That is the question that you need to know the answer, so that you can you can change your lifestyle. So, trans fatty acids are usually seen in red meat, especially in pork, and also in things like margarine, right. So, not butter also has a bit, but then margarine definitely. We think that margarine is a plant based food, so it would be better than butter, but you see that definitely margarine has this trans fat. The other place where this you get this trans fat or the bad fat coming in is if you are using your cooking oil over and over again. When you heat it recurrently and you do your deep frying or your whatever cooking that you are doing. So, what happens, the cis fats or the good fat, when you heat it up, they become this trans fat or the bad fat. So, that is where the bad fat comes in. So, pork, things like margarine, also animal food, especially the organ meats which I mentioned before, of a brain, heart, kidney, intestine. So, those are the things that you have to be careful of. Also seafood, you see that there is a huge amount of cholesterol that comes from things like prawns, cuttlefish, non-fish seafood. Or there is good seafood, like if you can get the fatty type of seafood, like if you can say kelevalla or hurulla or that type of fish, the sardines, the tuna, and so on and so forth. So, the fatty fish, those would give the good fat coming into your diet.
Right. Now, to talk about drugs in high cholesterol, so we know that since most of our population is using these drugs, it is very well commonly known, people use these statins. But is it, when you start medication for a person, is it lifelong?
Very good question. We are at the moment doing a guideline on this as well. So, the decision of starting a medication for cholesterol, I reiterate that you have to see a physician with regards to that, take your lipid profile, he will do the risk assessment. If the doctor says that you need to be on a statin, that with good faith the doctor may be telling that is to reduce this risk of developing a event like a heart attack or a stroke in the next couple of years. So, the doctor would start on a statin. You have various statins in the market, you get atorvastatin, rosuvastatin. So, those are the two main ones that you would see. and you see that the doctor tells, okay, maybe in 3 months time, not maybe, usually we tell in 3 months time you have to do a cholesterol and comes. That is the rough time that you would tell a person to repeat the cholesterol, because it takes a bit of time for the cholesterol to clear off and the body to become attuned to the drug. So, you need to take the medication, and if the doctor tells, okay, let us not reduce it, let us continue it, it is essential that that you take that drug, because if when you stop the statin, again the cholesterol levels could go up. So, you should not stop statins immediately. The decision of stopping the statin is it should be based on a lot of other things, just like the way that the decision of starting the statin was made by the doctor. There are a lot of other key players coming in. So, unfortunately, when somebody starts you on a statin, you may need to take it for a longer period. That is to prevent these unnecessary, very devastating, sad consequences coming into your life. So, it is essential that you need to be compliant. Another important factor that I want to stress about is about taking this drugs called statins. You need to take it in the night. Why is that? The time that you are sleeping, the time that your body has shut down and resting, that is the time that the liver is more active with this cholesterol building up enzyme or the chemicals. So, what statin does is this drug goes and gives the signal to the liver to shut off or to reduce the cholesterol synthesis or generating process. So, you see that the liver will not produce more LDL or bad cholesterol, so that it will float in blood. So, statins are given for that. In a certain fraction of people, you see that statins can give rise to side effects. So, what are these side effects? So, if you develop things like soreness of your body, if you do pains, body aches, worsening body aches, if you feel very unwell, if you feel nauseous, if you feel if you do not have an appetite. So, once if that has happened, once you have been commenced on statin, maybe a couple of days, maybe a couple of weeks, you need to go and see your doctor. So, the doctor will examine you and the doctor will tell you, okay, to do some blood tests. It may be a test like a liver profile, not lipid profile, a liver profile to see whether the liver is a little bit enlarged, or whether a blood test called CPK, or we call it creatine phosphokinase, not creatinine. This is creatine phosphokinase, which is a chemical that is there in your muscles, which is the chemical that produces energy in your muscles. So, if those levels are high, then the doctor may tell you, okay, you need to reduce your statin dose, or you may need to space out. There are certain people who take statins maybe thrice a week or twice a week. So, but then there are risk factors, the risk analysis gives a higher reading. So, therefore, they need to be on a statin at even in a slightest dose. So, the doctor would make the decision with you with good faith to get your cholesterol under control. So, statins should not don't be scared of statins. Of course, there's a whole heap of anecdotal literature and various sites on internet which would say, okay, statin has caused liver cancer, kidney failure, diabetes, this and that. So, the development of those things are not yet established, those are just anecdotal or hearsay things. With regards to diabetes, I recently read an article which said that for one person to get diabetes because of statin, that there should be the statin should have been given to about 450 other people, and it should be going on for more than 4 years. So, you say if you are the 451st person, The other 450 would have to take the cholesterol lowering drug for at least about 4 years. So, you see that the risk is less. Just an analogy, if I may, if somebody is driving on the road, the risk of having a road traffic accident is very high compared to a Boeing 747 coming down. So, that is the risk analysis that we are talking about.
Definitely, that was a very in-depth description on why you should be taking statins and how you should be taking statins, the possible side effects, and always, as we reiterate in Healthline, don't try to stop your medication without consulting your doctor, and same applies to starting a medication, because it is a widely used drug, it is sometimes given over the counter. So, don't try to self medicate, always do that with consultation of your treating physician. So, with the time constraints that we had, we are coming towards the end of this program. I think it was a very in-depth and very informative discussion. I am sure all our viewers took a lot of good information from it, and if we can touch your lives by doing this program, that is our objective. So, I think with this topic we did justice to our viewers as well. So, I thank Dr. Shehan Silva very much. Thank you, sir, for coming into the Healthline programs and gracing our studios this evening and talking about this very common topic which is affecting people. So, thank you very much once again, sir. And with that, it is time for me to take your leave from this episode of Healthline. Until I meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, wishing all our viewers Aibowan.